I'm Dr. Carlos Lucero. I am a pediatrician and I work in West Virginia for 33 years as a neonatologist and a pediatrician. I went to medical school in Argentina, in Cordoba, and also I did partially training in Argentina as well as in United States, Buffalo, in Cleveland, Ohio, and Charleston, West Virginia. And in the last 10 years, I have become very interested in learning more about the environment and the influence the environment has in us, children especially, in relation to health. The importance of this conversation and presentation is in relation to how to recognize the chemicals or the physical component that may harm us and how to prevent from being exposed to these chemicals and how to improve our health in general. First, I'd like to give some definitions. The first one is in regard, and I'm going to read it, is in regard to what is health. And health is absence of evidence for disease or abnormalities. Wellness is the fullest realization of physical and mental well-being and involves attitude, fitness, diet, and avoidance of unhealthy habits. Nutrition is the process of providing or obtaining the food necessary for health and growth. And disease, according to the Merriam-Webster Dictionary, and this one was edited in 1995, is an impairment of the normal state of the living body or one of its parts that interrupts or modifies the performance of the vital functions and is a response to environmental factors as malnutrition, or to specific infectious or infective agents such as viruses, to inherent defects of the organism such as genetic anomalies, or a combination of all these factors. And I would like to add to this definition how toxins can also influence the body and cause disease. So the question is, why do we get sick? Well, there are three main reasons why do we get sick. One is the quality of the food that we eat now is not the same as the food that our grandparents ate 70 or 100 years ago. And the reasons are several reasons. One is in order to have the produce that are harvested in such places like California, in order to get to faraway places like the East Coast, they have to harvest this produce green. So they ripe during the transportation process. That's one of the reasons why the amount of minerals and vitamins inside the food is less than what it's supposed to be. The second one is the way the farmers are now doing their farming is different because they use a lot of chemicals, fertilizers. They don't allow the ground, the soil, to rest, but rotating these plantations. So for that reason, the food or the soil is not able to give enough minerals and the vitamin that is needed. And also, many of us eat food that is processed food, which means it has been modified with chemicals to preserve, and in some cases adding other substances like colorants, sugars, salt, etc. The second reason is we are being exposed to many substances that are, I would say, very dangerous. And these ones are especially toxins, chemicals that we are being exposed when we breathe the air, we drink water, or we eat food. In any of these areas, there are chemicals that have been thrown into the environment, and then we are in contact with these chemicals. And the third one is the way of life we have at the present time is very stressing sometimes because the situation going in the world, political problems and terrorism, sometimes work conditions and stress in general, that all of this combined is going to make us to be more prone to get sick. And which one are the main, I would say, components of this possibility for illness? We're going to start with one, which is the plastics. Plastics are in everyday life. We are exposed to plastic when we are drinking water from the bottle. Many of the containers of food are plastic. Sometimes even if it is a container made out of aluminum or cans made with iron, they still contain a film of some sort of plastic inside, and these plastics, they are chemicals which has been shown that may affect the cells and the organs, and it may induce in some cases to diseases, and one of the most significant will be cancer. The next one is radiation. We are being exposed to sunlight, and the sun emits radiation that we will be receiving, especially if we are for long hours exposed to sunlight. There are also radiation from other sources. Some of the home, I would say, home utilities and so on, like we use microwave, for instance, television, radios, and so on. They do have also emit some radiation. The other one is when people are seen in a hospital, they are going to be exposed to radiation, whether it's by X-rays, CT scans, etc. Especially CT scans, I like to point out that is very dangerous to children. And in the last few years, there have been an increased incidence of cancer in children, especially those children who have been overexposed to too much radiation due to CT scans or other radiation procedures. The other one will be the contamination, as I mentioned before, of the air, the water, or the food. As we see that the use of pesticides is increased in the last few years, especially to preserve produce like fruit or vegetables. These pesticides are they are similar to hormones. They mimic hormones. For that reason, they are called endocrine disruptors. What that means is because they are similar to hormones such as estrogens, may cause alterations or malformations on fetuses, especially the mother is exposed to these pesticides in the water she drinks or the food she eats. And in the case of being a male fetus, they may have malformation in the organs, especially the genitals. But also in females, the hormones that are being placed in food, for instance, that is used on poultry, on cows, in order to have a better and larger size chicken, for example, they are given hormones on top of antibiotics. So many of these, the child or the adult that is taken, but especially on girls, it may cause alterations on their growth, especially on the girls' sexual development. they can have larger breasts earlier than usually used to be, or they develop secondary characteristics such as pubic hair, axillary hair, at very early ages, like 8 or 9 years of age. So these hormones are affecting the development of children, in this case, especially females. Excuse me. The other one are also exposure to different types of toxins in the water. For instance, the water is very important for us because we do need to drink large amount of water. But what happens is if the water is contaminated, for instance, in the process of having clean water, they use chemicals to purify the water. These chemicals, although they are meant to keep the water free of bacteria and parasites, unfortunately, they may be chemical can induce cancer. So for that reason, it is recommended to filter the water or to use distilled water. And the filter has to be a very good quality or have a double filter before drinking the water. And the next one is on the air. And there are many substances that can contaminate the air. Some are they used daily at homes, for instance, cleaning products to clean the homes may contain allergens, and these are chemicals that may also alter the functioning of the cells and the organs and the tissues. And halogens are in many things that we use at home, whether it's cleaning products, sometimes it's also on toothpaste, it can be on shampoos, many skin ointments and are used contain halogens. So all of these are chemicals that are going to contaminate the environment. In regard to radiation, I'm going to mention also another type, and it's the one that emit electromagnetic fields. These ones are objects such as cellular phones that emit radiations that also do cause some alteration of the cells and the tissues. For that reason, it's recommended not to have a cell phone too close to us, or in this case to the head. It has to be at least 12 inches in order to avoid the effect of these radiations that are going to alter the functioning of the cells. So there is also another thing is that some of the medications that we use, because the person needs to have these medications, may cause alterations. We all know how dangerous are antibiotics if they are not needed, because it's going to alter the intestinal flora, which in turn may decrease the activity of the immune system or to cause chronic intestinal conditions that the person may have to suffer for life. So that's very important, because especially in children, not to use antibiotics unless it's absolutely necessary. The other one is substances that are used to treat conditions such as hypertension. In these ones, the problem is may cause, if it's diuretics, may alter the mineral content of the plasma or the serum, such as potassium, sodium, and will cause an imbalance of these minerals. Also decrease the amount of an important enzyme that we need is called CQ10. And the same is with the statins, which are used to decrease cholesterol. And for that reason, the person taking these medications need to be supplemented with vitamin, especially vitamin B complex, as well as CQ10. The other one is metformin, which is used for diabetes, that also, similarly to other medications, can decrease the production and the cell or the amount of CQ10. For that reason, it had to be supplemented also with the CQ10 and vitamin B complex. Antidepressant medications, it's same. It may cause decrease of the CQ10 as well as B and B12. So for that reason, it has to be supplemented with this. But the most important, I think we need to be aware, is any of these substances may decrease the function of the immune system. If we don't have a good functioning immune system, we're going to be exposed to develop either acute conditions like infections or chronic conditions like cardiac condition, diabetes, arthritis, because the immune system is the one that is protecting us from these problems. For that reason, it is very important to consider this as part of the solution to the problems. So the solution will be mainly three things. One, of course, will be good nutrition, which means avoid or decrease the amount of meat, especially red meat, and eat more white meat or fish. But more important is to use fruit and vegetables, especially fresh and raw. The second one is to drink enough amount of water, with clean water, because it's important to detoxicate or to eliminate, help to eliminate this substance that we have accumulated in our body. For that reason, there is a advice sometimes to do for 7 days or 1 week, to drink mainly water and to eat only fruit and vegetables in raw conditions, such as apple, especially carrots, but any other fruit or vegetables that are not cooked is also important. But the third one and most important is, as I mentioned before, is to supplement with necessary nutritional supplements. And especially, I will mention, because now it's available, to be able to take vitamins or nutritional supplements that contain factors or transfer factors, which are very important for the immune system, and to be aware that this transfer factor can protect the body and all the organs much better than any other supplements. For that reason, we are going on the second part talk more about this it's factor of transference factor that will improve our immune system. I also will have available my phone and my email for whoever would like to have any questions or to ask me in regard to either how to improve conditions such as in relation to the immune system. So I appreciate that you listen to me and to this presentation. I thank you for your attention, and I hope we can meet again and continue this presentation next time. Thank you.